Yoink. There we go. So the menstrual cycle includes two components, the ovarian cycle and the uterine cycle, and they're happening simultaneously. The ovarian cycle is what's happening in the ovaries, and that's primarily egg development. And the uterine cycle, it happens in the uterus, and that's essentially the uterine lining getting nice and healthy and full to support the fetus if there's ever an implantation of the embryo. And if not, then it's going to do something called menstruation, which is like we described yesterday. It's just like get rid of everything and then just start all over again. And we broke down the ovarian cycle into 3 steps: follicular phase, ovulation, and luteal phase. Follicular phase is called the follicular phase because of the follicle. A follicle is an immature egg. And I was looking up some stats today, and it says that by 20 weeks in your mom's uterus, you guys had, the females in here, had 7 million follicles. And then the day you were born, you had 3 million follicles. It reduced. And then when you hit puberty, you only had, I think it was 300,000 follicles. And then if you do your math from your age of puberty, so when you hit puberty until menopause, it's probably maybe 30 years. And you probably would menstruate, 12 times or so in those years. So that's only like 600 eggs or so, follicles that actually mature. So you got all of these follicles to begin with, and all of a sudden you're just using a very select few of them. So the follicle matures, and then day 14 you ovulate. That's the release of the egg. And then your ovaries continue doing something called the Lutrio Phase, where this hollow body that remains produces a really important hormone. And that's it right there as a picture. So the follicle matures, releases the egg, and then that weird popcorn thing is the remnant while the egg is gone. And that will release special hormones. And it will continue doing that if you become pregnant, and if not, the hormones stop. The uterine cycle also has 3 steps, and they're happening simultaneously. So menstruation is day 1, and that usually, day 3 to 5 or 7 days. And then you go into your proliferative phase, where the endometrial lining proliferates. So it gets bigger and thicker and thicker and thicker. Day 14 is ovulation. It's not in the uterus, but that we wanted to identify the time there. And then your uterus becomes secretory. It goes into a secretory phase. And you can see the root is secretion. So it will actually start secreting its own hormones and mucus. And that will continue as well if you become pregnant. If not, it will stop and go back to menstruation, right? And then start all over again. So those are the 2 phases we want to talk about. That's how they line up. So the thing that links them are right here. Ovulation is right there. And today what we want to chat about are these 4 lines. Check it out. This blue line, which is called luteinizing hormone. This yellow line, which is called follicle stimulating hormone. This green line, which is estrogen. And then this purple line, which is progesterone. So we have 4 hormones we have to talk about. And look, they're not flat. They're not a static value. So in males, we have luteinizing hormone. Remember that? We have follicle stimulating hormone, but it's static. And it's static because of negative feedback. And then we have a hormone, sounds like estrogen and progesterone because a little bit, but it's testosterone. And testosterone is flat too. And yeah, we have a couple of spikes, right? When the male is in the mom's uterus, they have that one testosterone spike. When you hit puberty, and then maybe a couple times after puberty, you'd get more spikes. But we measure that in years, and for the female sex, we measure it in 28-day cycles, right? So that's what we're going to chat about today. Let's take a look at it. So I apologize, there's some words. I tried to do it with pictures mainly, but then I just summarized them in words as well. So we'll see how this works out for you guys. So Just a reminder, that's the uterine cycle where the uterus sloughs off, rebuilds, sloughs off, rebuilds, sloughs off. Here's the ovarian cycle. This is where one lucky follicle matures into an egg, is released, and then this weird popcorn structure arrives. It's actually this. It's the envelope. And if nothing happens, if there's no fertilization, then it'll just go back to day one again. And like I said, you can superimpose these because they're happening simultaneously. And again, this is the stuff we have to talk about, those hormones, those blue and yellow and the green and red hormones. Okay? Now we know, so the hypothalamus and pituitary, those ones we know of already because they're the same as, they're homologous to the boys, right? We talked about how the hypothalamus releases GnRH, cues the anterior pituitary gland to release luteinizing and follicle stimulating hormones. So that's the same for the female. But the male would produce testosterone from the testicles. The ovaries will produce two hormones called progesterone and estrogen. Okay. Now, there's sections of your 28 days where it's negative feedback, so it kind of looks like a static value. But in those 28 days, you have spikes in all of those values, and those were obviously a product of positive feedback. So when you get this really off-balance value, which is necessary, but it's not flat, it's a spike, that's positive feedback. That's an example of positive feedback. As you can see, this is negative feedback, flat, and then we got a spike, we got a spike, we got a spike. So those are positive feedback. And this correction also is a positive feedback, right? It's saying less. Here, fairly flat. Here, a little bit dropping actually, but these things are close to static. Spike, positive feedback, right? So going up is positive feedback, and coming back down is also positive feedback, just in the opposite direction. And then static, and that would be negative feedback. So let's compare. This is the girl. This is the female. GnRH tells the anterior pituitary gland to release luteinizing hormone and follicle stimulating hormone, and this acts on the ovaries. Well, this looks really familiar, doesn't it? Because this is very akin to this one, which is the boys. GnRH, anterior pituitary, luteinizing hormone, follicle stimulating hormone, tells the testicles to make testosterone, and also tells the testicles to make sperm, plus a chemical called inhibin. And those things negatively feed back here saying, okay, we don't need so much. And then it goes down, and it goes, okay, we need more, and it goes flip-flop. In the female reproductive organ, same thing. Progesterone and estrogen is released by the ovaries, and it feeds back. So in those parts where it's flat, it would be negative feedback. Go slow it down, speed it up, slow it down, speed it up. But in those points where we see the spike, it would be positive feedback. You say, okay, this is what we need. Do more. Okay? So, but you can see very similar. So this is the female one right here. So it acts on the ovaries, producing progesterone and estrogen, and it can negative feedback or positive feedback if you want it flat, or if you want it to go way up, or if you want it to go way down. Okay? So the 28-day cycle, in the ovaries, follicular, ovulation, luteal. In the uterus, menstruation, proliferative phase, and secretory. Again, 28 days superimposed on each other, happening simultaneously, and this is the image that we have for it. So let's take a look at the hormones now. Now, these ones are the ones that are homologous or identical to the ones found in boys, in men. So GnRH, gonadotropin-releasing hormone from the hypothalamus, releases the chemical to the anterior pituitary gland to secrete FSH and LH. Follicle stimulating hormone and luteinizing hormone. In follicle stimulating hormone, it tells the testicles to make sperm. Luteinizing hormone tells the testicles to make testosterone. In the woman, in the female, it tells the FSH tells the ovary to mature an egg. And the luteinizing hormone comes and tells the ovaries to start producing estrogen and progesterone. Okay? Luteinizing hormone also has another effect. It's the one that tells the ovary to release the egg as well. Both of them are needed for, so if you only have one, you don't have this one or you don't have this one, you won't have proper follicle and egg development. So you need both of them. But follicle stimulating hormone is the one that initiates it, and luteinizing hormone is the one that tells it it's ready and ripe and it should be released. In the uterus, you have two hormones, and many of you probably heard of these ones before in health classes and such. It's estrogen and progesterone. Now your ovaries will produce them. Your ovaries will produce progesterone and estrogen, but other parts of your body will also release this too, specifically the uterus. Okay, your uterus will make them later in pregnancy, but typically it comes from your ovaries. This from the follicle in your ovary, and this one from the corpus luteum in your ovary. Okay. So as you can see, this is where you're starting to get ready for menstruation. And as you're getting ready for menstruation, you can see your FSH is increasing, follicle stimulating hormone. And now you'll be in menstruation. So your uterus would be bleeding and sloughing off tissue. But in the ovaries, you have a high or higher, you can see it's a little bit elevated FSH. And the FSH is telling your follicle to start maturing. And you can see due to a bit of negative feedback, it comes back down to a more homeostatic number. Okay? And your body will be here and saying, hey, wait a minute, FSH and LH are kind of low. And you'll say, we need to fix this. And right around here, it starts producing more LH and more FSH, right, to correct it. And at this stage, your body actually goes into positive feedback mode and says, okay, it's going up. Should we lower it? And it says, no, we're just going to keep elevating. And it spikes. Now, both of them spike. See that? But luteinizing hormone spike is the one that tells this thing to pop and release the egg. And that happens around day 12, 13, 14, 15. And follicle stimulating hormones kind of just going along for the ride. Okay? So it's just going along for the ride. Once it's released, this thing here turns into this popcorn. And this popcorn, right, will produce progesterone in high levels, which we'll show you in the next diagram. But after the spike in LH and FSH, they both come crashing down due to positive feedback, right? Go down. And then they'll level off here. And here you're seeing a little bit of negative feedback, just kind of flat again, right? So that's the ovarian cycle. Day 1 through 13, FSH promotes follicle development. Follicle secretes mainly estrogen and some progesterone, but mainly estrogen, and we'll show you that picture superimposed in a sec. And then estrogen has a negative feedback to hypothalamus, and FSH and LH drop. See how they both kind of drop a little bit? Because this thing is producing estrogen. And it's saying we don't need more FSH, we don't need more LH because our estrogen level is a little bit elevated. And it comes down. And then, because of the low FSH, the low LH, your body goes, okay, it seems like we're really low in those, we should pump them up. And that's the spike. Right? It goes, okay, let's increase it. And instead of negative feedback, increase it to a static value, it increases it to a spike. And again, LH is the one that triggers this, the popping of the, or the release of the egg. Right there. So that's the release of the egg there, ovulation, it's called. Day 15 through 28, the corpus luteum appears. And this corpus luteum mainly secretes progesterone, although it does secrete estrogen as well. Okay? And progesterone negative feedbacks to anterior pituitary, and the LH further decreases. Okay, so see that? It goes down. The low LH causes the corpus luteum to disintegrate. So because your LH is coming down, the LH was supporting this a little bit, and now because it's low, this thing will disintegrate unless you become pregnant. Okay? Here's the uterus. So that's the FSH, LH spike, and then they come down, and then the corpus luteum appear. Well, let's take a look at this, the uterine cycle. So estrogen flat, progesterone pretty flat, right? Now it starts elevating here. And why does it start elevating here? Because in your ovaries, your follicle is starting to produce it, remember? And this goes up, 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 and right here, because of your low LH, your low FSH, because of the elevated estrogen, the estrogen goes up. So your anterior pituitary gland says, okay, we don't need to release as much LH and FSH. So the LH and FSH is really low. And then your body goes, we're really low in FSH and LH. We need to make more, and it spikes. And that causes this ovulation right there. Okay? And then the high LH causes the egg to ovulate, to be released. But it also causes the follicle to change into a corpus luteum. And what does the corpus luteum produce? Mainly progesterone, and that's why this goes up. But the corpus luteum also produces estrogen. And here comes that little bit of estrogen that it's known for making as well. Okay? So the corpus luteum is responsible for those two bumps right there. Okay. And where is the corpus luteum? In your ovaries. So low estrogen and progesterone equals menstruation. So you menstruate because of relatively low estrogen and progesterone. Day 6 through 13, estrogen from your ovaries makes this start to build up, right? That's from your follicle and your ovary. And day 15 through 28, the corpus luteum appears because you ovulated. And that thing mainly produces progesterone, some estrogen. So that's why we see this first bump, because that's the corpus luteum producing progesterone. And the second bump is the corpus luteum producing estrogen. What does this do? It makes the endometrial layer even thicker. And it makes it more and more vascular because you need blood to feed the baby through the placenta. And it becomes secretory. So it secretes special chemicals to support the embryo that would attach and the placenta. It also starts producing mucus. So right there. Now, if you have sex, if you have unprotected sex, right, and you're trying to become pregnant, you only got about 24 hours after ovulation. It's a 24-hour window where that egg is viable. You might be able to fertilize it for longer, but it's not going to attach. It's not going to turn into the right number of cells to bind to the uterus wall, or it will actually be expelled. And just a reminder, the egg is released here, the sperm has to come all the way up here, and fertilization happens here in the oviduct or the fallopian tubes. So if fertilization happens here, it will divide, and be the right size to stick right here. If it's fertilized here, or fertilized way out here, it's not going to be the right size, and even though it's fertilized, it might not be viable. It might not stick around. So in fact, the egg itself is only viable for about a 24-hour window. Okay? The guessing is, when is that window? And then the other guessing is, how is your sperm, doing things, tricking your system into sticking around as long as it can to take advantage of that 24-hour window. Right? And we talked about how sperm can hide out in mucus and stick around in different folds and stuff like that. Just hoping, because all you need is just one. So embryo begins to develop in the oviduct, migrates and implants into uterine wall. It takes about 4 to 5 days, maybe a bit longer, to be fertilized, and then travel. And by the time it gets here, it's a couple hundred cells big. And one of the things it does is it starts producing something called human chorionic gonadotropin. It's a really long name, HCG. And HCG appears when the embryo attaches right to the uterine wall. And that is the chemical that we use to test if you're pregnant. So if you have unprotected sex and you think you're fertile, you're like, I feel like I might have ovulated within this 48-hour window or something, and we just had sex. We need to test it. You go to the department store, or the grocery store, or the pharmacy, and you get the sticks you pee on. You won't know. Because what are we testing for? We're testing for that. And when is that produced? 5 to 7 days later. Okay? So you have to wait. You unfortunately have to wait. And most people don't even think they're pregnant until they miss their period. But some people do get worried and it's like, whoa, the unprotected sex was 5 days ago, we should test. Because the earlier we know, the better we can plan. And so they test on day 5, day 6, day 7. And sometimes that's still too early, and you might get a false negative. It's very tricky to, your body does not produce this unless you have something bound to your uterine wall. So if you test positive for HCG, very unlikely it's bound something else by accident. Okay. Now, if you have unprotected sex and you're really worried, then you can take the morning after pill, right? And the morning after pill is entirely something different. It doesn't test to see if you're pregnant. It just actually terminates whatever's happening in your body at that time when it comes to your reproductive system. And so effectively, just a really high dosage of estrogen and progesterone, which is just tells your body something's not right. And then instead of allowing for a pregnancy to take place, it just says something's wrong, and then out it comes, right? Because your estrogen and progesterone levels are so elevated that something's wrong, right? And this happens, like, you know, if you become pregnant but your diet is not good, or your weight is not right, or, you know, sometimes even people would say your mood and things like that could actually have an effect on your pregnancy. And you know, like I said earlier, if you talk to someone that's tried to have a baby and they found it difficult, they may have had those instances where they tested positive, and then as a result, you know, later on they found out that it didn't happen, right? The fetus didn't fully develop, or it was lost. HCG, what does it do? Well, its big role is to maintain the corpus luteum in your ovaries. And that will ensure that you have adequate estrogen and progesterone for the next 3 months. After that 3 months, the placenta will actually start producing enough estrogen and progesterone to make sure that the pregnancy is good. Right? So there you go. Later on, the placenta also secretes estrogen and progesterone. That's a later secretory phase. Estrogen and progesterone prevent ovulation and help maintain the endometrium. So that's how the pill works too. Like if you're on birth control, you'll notice that you'll have 28 days of pills, and some of them are white, and some of them are blue, and some of them are pink sometimes, or yellow. And what you're effectively doing is you're taking a placebo. So the one-colored ones, the white ones usually, are just placebos. They're just to keep track of the date, really. So you take one, you take the next one. So you're just on a daily schedule of taking a pill. But every once in a while, you will take pills that actually have estrogen or progesterone or both of them, so that you trick your body into thinking that you might be pregnant. So when your body is pregnant, you do not produce a new egg. So you don't go through ovulation. So your body's like, oh, the hormones say that she might be pregnant, so let's just not make an egg this month. And that's what's happening. So, and you do that for like a 4 or 5 day window of taking the chemical, the progesterone and estrogen, and you can skip it. There's other ones too. You can actually take ones that block luteinizing hormone or reduce luteinizing hormone, which is the one that triggers follicle development. Yeah?
I heard that there is a number of like eggs like one woman can have, and if you take the pills like every month, does that egg die? Just like
It all depends. It depends because there's many different types of the pill, right? Like I said, some of the pill is dosages of estrogen. Others ones are dosage of progesterone. Some of them are a combination, and some of them block luteinizing hormone. So it all depends on what the process is to block it. Some would not even let the egg to mature, and others would let the egg mature but not maybe be fertilized. So, and that would be an example of losing that viable egg that month. Yeah. So it all depends on the mechanism. Yeah. Back in the olden days, people would have like 8, 9, 10 kids, right? And there's some concern about the higher occurrences of reproductive cancers and stuff. And one of the thoughts are that women are having children older, right? Another one is that they're having less children. And the less children thing means that when you're pregnant, actually, your ovaries stop working for that time you're pregnant. So while you're pregnant for 9 months, your ovaries don't have to do much. And the thinking is that if you're, in the olden days, we're kind of programmed to have 8, 9, 10 kids. So you're like 90 months off if you have 10 kids where your ovaries aren't, working hard. And that could actually be, I guess there could be a correlation. It could be a causal effect, actually, of some types of cancer, of never having your ovaries take a bit of a break by being pregnant, which is weird, right? Because you're pregnant, you're not really taking a break. So there are some women, actually, that will take the pill and the hormone supplements all the time. And what will happen is that these numbers will stay elevated all the time. And they don't even menstruate. So some people will do it and they won't menstruate for the whole year or the year and a half that they're on the hormones. And there was, some discussion about whether that is actually a healthy thing. And some speculate that the side effect would be that you would give your ovaries a rest. It's almost like being pregnant once and then giving your ovaries a bit of a break, right? When people have gastrointestinal disorders, often what we'll do is give their intestines a break. And we'll cut a tube, we'll cut a hole in their side, it's called a colostomy, and would redirect everything outside of their body and skip their intestinal tract. And the whole idea is to let their intestines take a break. And that, this is kind of along the same lines. Now, if your egg does not become fertilized, look what happens to your progesterone and your estrogen. They come down. And those declining values of estrogen and progesterone are the thing that indicates to your uterus that it needs to go into menstruation or menses. And then you slough it off. And because of these declining hormone levels, this is often, when women don't feel so womanly, because your womanly hormones are the lowest. And I think there's a correlation with a population of people of feeling a little bit, depressed or a little bit gloomy, a little bit less energetic and stuff. If you become pregnant, though, look what happens to your values. Your progesterone and estrogen go way up because those hormones have to be there to keep the uterus healthy and the fetus healthy and the placenta healthy. And these are the womanly hormones. So as a result, often you'll see these, someone will announce that they're pregnant and you say, I knew it. You were glowing, your hair was full, your skin was good, right? You had confidence, you're happy. And it's because your hormones could be really elevated, and those are the ones that make you feel good. Yeah? And you can see what happens to luteinizing hormone and follicle stimulating hormone. Way down. During this time, you do not make more eggs. Right? You don't produce a viable egg. So you're not like a bird. Birds always produce eggs. So they could have a baby chick coming, and then they could have an egg right behind them maturing that they could also fertilize. Humans, if you have an egg that's fertilized, you don't make any more eggs for now. Right? There's human chorionic gonadotropin, and that's created from the embryo itself, right there. Okay, so like I said, if you don't have an embryo attached, this comes crashing down, this comes crashing down. Luteinizing hormone's a little bit flat. Follicle stimulating hormone's picking up, saying, okay, we need the next egg to start maturing now. Okay, and we're going to do this all over again and see if we, if you're trying to get pregnant, if you're going to get lucky, or do we have to do it again, right? Do we have to start over another 28 days, 28 days, 28 days? So that leads to menstruation. So if your hormone levels drop, your follicle stimulating hormone picks up, the low estrogen and progesterone levels, they cue your uterus to start menstruation, and the arteries that supply the endometrium layer, they start to constrict, they start to cut themselves off. And that tissue starts to die. And it starts to weaken and slough off in patches. So what you have is tissue and blood vessels coming. And mucus, because in the later stages you're producing, you're in secretory phase, so you're producing mucus. And I don't think this is ideal, 10 days, but that's the data I got from my reading, 10 days. I've heard though, it could be 1 day, but I've heard that it's not good because it's really often associated with cramping and pain all in 1 day. So I guess there's an optimal window of time there, but 1 day would not be good, and 10 days doesn't sound good either to me. But there you go. Now, one neat thing that you'll notice, this is ovulation. So this is what your uterus kind of looks like. It's getting thicker. This is your hormone levels, but your temperature actually, there's a tie to your temperature. So another way to practice, another birth control method that you can take practice in is something called the rhythm method. And when you have this luteinizing hormone and follicle stimulating hormone and your progesterone levels spike, your body core temperature actually goes up a little bit, about 1/4 degree. And what you can do is you can take your temperature with a special thermometer every morning, right? It goes to the 1/10 of a degree, or even more accurately. And every morning you just put it underneath your tongue, right, sublingual, and you take your temperature and you map it on a calendar. And then you look for a spike in your temperature that stays elevated for a while. It's called your basal body temperature. And if it spikes about 2.3, 0.4 degrees, that's associated with ovulation and progesterone, estrogen, luteinizing hormone, follicle stimulating hormone. And some people practice this, right? So if they're in a committed relationship and they don't need to use the other types of barrier protection, they can do this and track their period and their basal body temperature over a couple months, 2, 3, maybe 4, 5 months, and then they can start pinpointing when they're fertile. And if you want to become pregnant, you would hit those certain dates or the dates around them. And if you're not trying to become pregnant, you would avoid those dates, those 5 days around that date, right? And the success of it depends on your regularity, your commitment to the data, right? Collecting the data and stuff. But it's pretty reliable. It's pretty reliable if you're doing a good job of collecting your data and you're fairly regular, right? If you have these weird fluctuations in your period, and it doesn't seem to follow a really consistent pattern, then probably you want to avoid this. It's called the rhythm method. So estrogen and progesterone, not only do they have roles in direct roles in reproduction, right? You need estrogen and progesterone to make your uterus A1 and comfy and feed the placenta and feed the baby and all that jazz. It also has secondary roles, right? So when you hit puberty, you would have estrogen and progesterone come in there for the first time, really, to help you develop your secondary sex characteristics like breast development, hair in different spots, and then where you start storing your fat, right, your adipose tissue, and your wider pelvis, right? And progesterone, a little bit less so, but yeah, it's also included in some of the secondary sex features. Now, men can produce sperm literally until the day they die unless they have something go wrong with their equipment. Women, on the other hand, reach something called menopause, right? Menstruation pause, stop. And this is usually around age 45 to 55. Some people have it in their 30s, and some people, right, they're having babies in their 70s. But on average, 45 to 55 to 55, sorry. And what happens is your ovaries become unresponsive to FSH and LH. So these chemicals come in and say, hey, time to make an egg. And your ovaries like, no one's home, not doing it, we're done. And then as a result, you don't get an egg. You don't get ovulation. You don't have, in fact, it ends up being that you stop having your menstrual period altogether, right? So because your body doesn't understand, right? It's sending out FSH and luteinizing hormone, and we already told you it's tied with basal body temperature. So your body goes into a bit of a weird fit. It's like, you know, you should be making an egg, you're not making an egg. Here's more LH or more FSH, right? And then things go wonky for a while, and those things cause, obviously, the hot flashes, which are tied to your basal body temperature, but dizziness, headaches, insomnia, and depression. Because remember, your ovaries are not sensitive to FSH and LH, so your estrogen and progesterone is going to drop. And we just talked about how, you know, elevated estrogen and progesterone makes you feel, you know, more, well, I guess the description is glowing, right? Everyone calls you, oh, we could tell you were glowing. So your hair is fuller, your skin is better, right? All those things that you would associate with estrogen and progesterone, and now they're gone. So usually they cause a bit of a depression in your state, right? Not everybody, but I guess enough in population that it's a concern. And so as a result, sometimes we have hormone therapy, replacement therapy, where we give you the estrogen and progesterone, and we try to help you stabilize your mood and your health. That's affected by the loss of your hormones. Now, if you stop menstruating for a year, that's it, menopause, right? So you could have spotty or really irregular menstruations, but once it's 1 year without, then you're technically menopause. Then your likelihood of ovulating and having a child is really, really low now. I think there has been people that have gone through menopause that have been surrogates, though, where they implant an egg, and then that uterus is used to bring a baby to full term, and then they carry the baby, and then they birth the baby, and then, but their body's tricked into thinking that it's theirs. Any questions about the hormonal control? It's pretty wild and wacky, isn't it? Like the numbers. And I know I was talking about ones going up, and you have to think, what's happening the other side? Because they're all intertwined, and it's really hard to see that. You know, this picture is probably one of the better ones to indicate how they're related, but then they're all tangled, which is hard. And then this one is probably a decent one too, but then because they're separated, you think that they're actually not interacting with each other, but they are. But so next day we'll take a look at these just one more time, just to remind you about how those hormones interact with each other, affect each other. But that's effectively it. That's the female reproductive system. Okay, so we looked at the anatomy, and we looked at the hormonal control, the physiology. So next day we will look at fetal development. So what happens now that you actually have the sperm and egg fuse, and it's attached to the uterine wall. What next? So the next 9 months. Okie dokie? All right.